We want to welcome you this morning to the webinar, Paired ACEs, How Adverse Childhood Experiences and Community Environments Can Impact Youth, and How the Prevention Community Can Help. So this is the second week of a series of webinars that are done by the Institute for Prevention and Recovery, and we're happy to have all of you here with us on this rainy but Friday morning as we get into the weekend. So before we get started, we just want to tell you all a little bit about the Institute for Prevention and Recovery at the RWJBarnabas healthcare system. So we refer to it as IFPR affectionately. It's a mouthful, so it's just a nice little way to tie it up. But basically, the Institute works across the state of New Jersey, offering prevention, intervention, and substance use disorder services. So originally, it was called the Institute for Prevention, but IFPR has been working to prevent youth substance use for decades. And a lot of people know very well today the peer recovery program and other programs on the side of recovery. And with all of this, the Institute works to perpetuate real change by facilitating effective long-term recovery for individuals suffering from substance use disorder. The Institute is also recognized for training and educational programs serving schools, hospitals, and communities all throughout New Jersey. All programs within the Institute are state or federally funded through grants. So you can see some information on the different programs that we have. So again, on the prevention side, we have the DART Prevention Coalition, Communities That Care, and then also as we cross the continuum, we have the peer recovery program, the deliberate reduction of opioid prescriptions, or the DROP program, which is hospital-based, the support team for addiction recovery, or STAR, Monmouth County Case Management, the tobacco and nicotine recovery program, strengthening families, and of course, the Reading Institute as well, that some of you guys might be familiar with. So if you want any more information on any of these services, again, we kind of span the entire state. We're happy to provide any information and we can get connected through there. And we'll give you guys our email addresses again at the end of the presentation, and we'd be happy to help however possible. So everyone can hear me okay, I'm assuming, because you guys haven't seen anything yet. But my name is Abby Thompson. So I am the Youth Prevention Manager at the Institute. So basically, I work on the prevention side of things on the DART Prevention Coalition. We are state and federally funded to do substance use prevention work in Ocean County. But again, we kind of collaborate throughout the Institute with all of our different coworkers, things like that. But my main focus is with our Youth Prevention Coalition. So we have 17 of them throughout the county. We have over 250 youth members who lead prevention activities within their schools and communities, with the help of some really awesome advisors, some of whom I think are on the call this morning. So a special good morning to you guys. So with the youth and with our adult members as well, we work to reduce underage drinking, youth marijuana use, illegal use of tobacco and nicotine. Of course, vaping has kind of been the hot topic for the past couple of years, and the non-medical use of prescription drugs. I'm also joined today by my coworker, Amy Piacente-Desch.
Hey everyone, I'm Amy. I work as a community prevention specialist along with Abby over at IFPR. My work is largely focused on the adult members of the DART Prevention Coalition as we work to reduce substance use through different types of initiatives. The coalition has 4 different work groups. Abby kind of mentioned some of those focuses before. There's generally a work group that kind of marries up with that. And then all the work groups will come together as a larger group every other month. So if you would like to get involved or would like some more information, we'd love to have you. And I'm definitely happy to provide more information. You can see our email addresses up on the screen right there. You can jot them down. We'll give them to you again later. But feel free to shoot us an email about anything you want.
So as we walk through today's presentation, we're going to introduce you all to the concept of the pair of ACEs. So I first learned about the pair of ACEs through a presentation from the New Jersey Department of Education that I was at a couple months ago. And when I saw the diagram, which I promise we will show you, I was instantly intrigued by the infographic and the way that it kind of depicted everything, but then also how it seamlessly tied together how the experiences in a child's home, as well as in their environment, can impact the young people and the families that we work with. So through drawing on this intersection of factors, we can assess a wide array of determinants that can negatively impact someone's health. And with this assessment, we can develop practices and policies which specifically address these issues and then mitigate the impacts of adverse childhood experiences and adverse community environments. So that's the other ACE acronym there. So that's kind of what we're going to talk about today. But before we do that, we also want to preface the rest of the presentation by letting you all know that we are certainly not experts in ACEs. Amy and I both have prevention backgrounds. So we really are here today to report out on tools, frameworks, and resources that we have found helpful in our own community-based work. We've been working to understand what actionable steps that we can take to address ACEs in the youth substance use prevention fields, and also how we can use these tools to mobilize our community members and our coalition members. So the pair of ACEs really has helped us kind of see that, get some clarity, and we hope that the introduction to the concept does the same for you. But we do promise at the end of the presentation, we will provide you with a list of resources and tools that you can use, and then also you can kind of tie back to the true experts in the field and have their resources at your fingertips. So during the presentation, if you have a question or comment, please feel free to use the chat feature, and we will also have an open discussion at one point. And at the end, if there are any questions, or again, you can kind of email Amy or I, we are more than happy to get back to you. So thanks again, everyone, for joining. And we'll get into the meat of it now.
So I'm sure many of you have heard of adverse child experiences, or ACEs. Maybe you attended a webinar or a conference about the framework, read a news study or a journal article, or are even working within your own organizations, schools, communities to address the ACEs issues. It's definitely one of the hot topics right now as we work to determine how we can help children grow in healthy, supportive, and nurturing environments. One of the things that I've personally struggled with is understanding how I can use this knowledge in my everyday work and really make a difference when it comes to ACEs. The pair of ACEs concept, that is the topic of this webinar, has helped me understand it a little bit more. We're going to do a brief overview of ACEs to ensure that we're all on the same page. And we're going to show you a video. It's to give you a little perspective on brain development and how a child's experiences can impact the development of the brain. But I will warn you, it might play a little bit loud, so prepare to turn down your volume.
We tried to adjust it so that it wouldn't blow your ears out, but fair warning.
Science tells us that the experiences we have in the first years of our lives actually affect the physical architecture of the developing brain. This means that brains aren't just born, they're also built over time based on our experiences. Just as a house needs a sturdy foundation to support the walls and roof, a brain needs a good base to support all future development. Positive interactions between young children and their caregivers literally build the architecture of the developing brain. Building a sturdy foundation in the earliest years provides a good base for a lifetime of good mental function and better overall health. So just how is a solid brain foundation built and maintained in a developing child? One way is through what brain experts call serve and return interactions. Imagine a tennis match between a caregiver and a child, but instead of hitting a ball back and forth across a net, various forms of communication pass between the two. From eye contact to touch, from singing to simple games like peekaboo. These interactions, repeated throughout a young person's developing years, are the bricks that build a healthy foundation for all future development. But another kind of childhood experience shapes brain development too, and that's stress. Good kinds of stress, like meeting new people or studying for a test, are healthy for development because they prepare kids to cope with future challenges. Another kind of stress, called toxic stress, is bad for brain development. If a child is exposed to serious ongoing hardships like abuse and neglect, of health problems, development issues, even addiction. It's possible to fix some of the damage of toxic stress later on, but it's easier, more effective, and less expensive to build solid brain architecture in the first place. One of the things that sturdy brain architecture supports is the development of basic emotional and social skills, an important group of skills which scientists call executive function and self-regulation can be thought of like air traffic control in the child's mental airspace. Think of a young child's brain as the control tower at a busy airport. All those planes landing and taking off and all of the support systems on the ground simultaneously demand the controller's attention to avoid a crash. It's the same with a young child learning to pay attention, plan ahead and remember, and follow lots of rules. Like all of us, kids have to react to things happening in the world around them, while also dealing with worries, temptations, and obligations on their minds. As these demands for attention pile up, air traffic control helps a child regulate the flow of information, prioritize tasks, and above all, find ways to manage stress and avoid mental collisions along the way. Having this ability is a necessity for positive and level mental health. Developing effective air traffic control, overcoming toxic stress, and building solid brain architecture are things kids can't do on their own. And since strong societies are made up of healthy, contributing individuals, it's up to us as a community to make sure all young people have the kinds of nurturing experiences they need for positive development. To build better futures, we need to build better brains.
Okay, so sorry that the video froze briefly, but as we all know, the internet has been a little bit buggy since everybody is home during the day now. So bear with us if it happens again, fingers crossed that it doesn't. But as the video explains, the experiences we have in the first years of our lives actually impact the physical structure of our developing brains. Children's brains are built over time based on both their positive and negative experiences. Positive experiences with their caregivers can build and maintain great foundations. However, negative ongoing experiences like the ACE events, like the violence, poverty, and exposure to family members using substances can cause this toxic stress, which can cause physical damage to these developing brain structures. And as this damage could lead to health problems, development issues, and even substance abuse. While it's possible to fix some of the damage of toxic stress later in life, it is far easier, more effective, and less expensive to build solid brains right from the start. So since kids can't build solid foundations all on their own, it's up to us as a community to make sure that all of our youth have the nurturing experiences that they need to have this positive brain development, which is where prevention can come into play. So what exactly is an ACE? The CDC writes that adverse childhood experiences are potentially traumatic events that occur in childhood. ACEs can include violence, abuse, growing up in a family with mental health or substance use problems. Toxic stress from ACEs can change the brain development and affect how the body responds to stress. ACEs are linked to chronic health problems, mental illness, and substance misuse in adulthood. So just as we mentioned to our youth coalition members while discussing risk and protective factors for substance use, we want to remind you that everyone who experiences an ACE, it's not prescriptive, meaning it's not going to definitely occur. Something negative, a health or a life outcome is not definitely going to occur if you have ACEs. However, the more ACEs that exist, the greater the likelihood of experiencing negative health outcomes also exists. So the more that we can do to create and strengthen protective factors in a child's life, the less likely they are to experience a risk factor like an ACE and the related negative health outcomes associated with it. So in order to assess the impact of ACEs, we must have a way to measure them. So the original landmark ACE study was conducted at Kaiser from 1995 to 1997 with 2 waves of data collection. It was one of the largest investigations into childhood abuse, neglect, and household challenges, and then the later life health and well-being of those individuals. It sought to measure potentially traumatic events that occur between the ages of 0 and 17, so basically birth through your teenage years. The study found that over 1 in 4 adults reported at least one ACE, with 38% reporting 2 or more. The interview instrument grouped these experiences into 3 main categories: child abuse, neglect, and household challenges, which resulted in a tool of 10 questions to yield an ACEs score between 0 and 10. So for those of you who are not familiar, we wanted to kind of just show you some of the questions that are on these ACEs quizzes, if you will. Something to keep in mind is that this is a retrospective survey that asks adults to reflect on their experiences when they were a child and not actually given to a child. So questions can ask about emotional and physical abuse. It could ask about child neglect, substance use or of the caregiver, and even mental health of household members. So up on the screen there, you can see a handful of those questions, just to take a quick little look over to see what some of those questions might look like. It's also interesting to note that, as pointed out by research at Harvard, that this is not a complete list. For example, stressors experienced outside of the household are not even discussed in this. It also fails to highlight protective factors a child may have, and the questionnaire can tell us who might be at risk, but not who is definitely at risk.
Sorry, I was answering a question in the chat. I didn't mean to advance, guys.
It's okay.
Okay, so as we saw in that video, the presence of ACEs, it impacts our building block years. So these are the really crucial times in our childhood that will set the foundation for adult relationships, our different behaviors, health outcomes, or social outcomes. So really it's the key part of our brains are very malleable right now, or when we're a child, and all of these different structures are forming. So as a result, if a child lives through the traumas associated with ACEs, they can have a domino effect on the rest of our lives. So this is a diagram that was recreated from something that the CDC put together, but you can kind of see how an adverse childhood experience or experiences, it disrupts neurodevelopment, which then impacts social, emotional, and cognitive impairment. This could lead to the adoption of risky health behaviors, which of course we know can impact life potential. This can lead to disease, disability, and social problems as well. And unfortunately, in some cases, this can lead to early death. So again, you really kind of see that there's a domino effect and how that accumulation of these experiences will can potentially negatively impact a whole bunch of different life outcomes, opportunity, things like that. So we also know that experiencing these childhood traumas, it can cause toxic stress. So this is one of the concepts that was brought up in that video as well. So basically, toxic stress, it can harm the nervous system, the endocrine system, and the immune systems. And some researchers even say that it has the potential to change the structure of our DNA physically, which also means that this could potentially be passed down from parents to their children. So this toxic stress, it impacts our attention, our behavior, our decision-making skills, our learning, emotion, and then of course, our response to stressful events in the future. So our bodies react to this tension with a heightened level of cortisol. So really any tension, cortisol is going to start pulsing through your veins. But when it's continuous and constant, it essentially leaves children in a constant state of fight or flight. So when this is prolonged again, this is when somebody experiences toxic stress. So I want you guys all to kind of pause for a second and think about what happens when you're in a frightening situation. So maybe you have a major presentation to deliver at work, like Amy and I this morning. We hopped onto the webinar, or maybe you had to slam on your brakes to avoid what would have been a really bad car accident on your morning commute. Again, I know most of you are working from home, but I'm sure that's happened, unfortunately, in the past. So when these situations occur, you might start to tremble, you might become pale or flush, depending on how you kind of react as a person. You might feel like the wind is knocked out of you. And of course, your heart rate probably becomes more rapid and your breathing more intense. So your body reacted appropriately to that frightening situation, and it basically prepared you to react if necessary by making all of those different things in your body occur. So if all goes well and you weren't seriously injured and it really was just kind of more of a fright than actually a bad incident, your breathing should return to normal, your heart rate will slow back down, and you'll feel like yourself again. But what if that never went away? What if you were never able to fully relax from that state of stress and panic, that feeling that you were on edge and needed to protect yourself? So that feeling, that constant looming pressure on you, on your chest, or however you kind of feel that, that's toxic stress. And that's what an accumulation of ACEs can do to a child. So the CDC writes that children growing up with toxic toxic stress may have difficulty forming healthy and stable relationships. They may also have unstable work histories as adults and struggle with their finances, jobs, and depression throughout life. These effects can also be passed onto their own children, as I mentioned before, kind of when we talk about the intergenerational impact of ACEs. Some children may face further exposure to toxic stress from historical and ongoing traumas due to systemic racism or the impacts of poverty resulting from limited educational and economic opportunities. So again, ACEs really kind of tie into this concept of toxic stress. There are a whole bunch of really interesting articles out there on toxic stress and health outcomes as well. So if you're interested in this, I highly encourage you, especially with birth outcomes for minority populations. It's one of the things I find really interesting. So definitely take a look at that, just kind of a side note. All right, so what we do know, sorry guys, okay. That ACEs and this toxic stress, so they kind of erode three critical components of those building block years of childhood. So it interferes with safety, stability, and bonding. So the disruption of these factors, it interferes with health, opportunity, and well-being.
So we also know that 1 in 6 adults have experienced 4 or more types of ACEs. And at least 5 of the top 10 leading causes of death are associated with ACEs. And you can see them listed here: heart disease, cancer, respiratory disease, diabetes, and suicide. We also know that preventing ACEs could reduce the number of adults with depression by as much as 44%. We know that we are preaching to the choir, as most of you are very aware of ACEs and their impacts, but we also know that all of you want to prevent and mitigate ACEs as well. So if we can all do this, we can lower the risk for serious health conditions, reduce risk behaviors, improve education and employment potential, which will help our youth become productive members of society and stop the intergenerational trauma and the cycle of ACEs. But how do we do this?
So as we mentioned, one of the things that we kind of struggle with most within our own work in the prevention field, and then also in my personal life, is there's different things that I care about, is how to apply ACEs to our daily work. So how do we take something that's a retrospective survey that measures childhood experiences that happened in someone's past and act on them now? So is there a tool to measure ACEs within youth? And if there is a tool, who would use that? Is it schools? Is it counselors? Is it pediatricians? Is it child study teams? What does that look like? And we all are wearing so many different hats already. So we just really struggle to kind of understand what we can do from our area in the helping field to kind of address ACEs. So we were able to kind of see a little bit of a bigger picture when we learned about the pair of ACEs, or the ACEs tree. So the pair of ACEs concept, it comes from the work of the Building Community Resilience Collaborative, or the BCR for short, another one of those acronyms. So the BCR is within the George Washington University School of Public Health. So basically BCR, they seek to improve the health of children, families, and communities by fostering engagement between grassroots community services and public and private systems to really develop a buffer that protects against both adverse childhood experiences and adverse community environments. So they kind of phrase it as adverse childhood experiences which occur in adverse community environments, which is what they call the pair of ACEs. The center seeks to connect community organizations with larger systems to begin to build a network that will help improve community well-being. They have sites all across the country. They're in the greater Cincinnati region of Southwest Ohio, Northern Kentucky, Dallas County, Texas, the state of Oregon, the Washington, D.C., Maryland, Virginia area, the state of Washington, and a couple other spots as well. So a lot of this, their work, it is kind of similar to those of you who are from coalitions or who are working, who sit on any type of coalition or community group, any networking, any task force, thing like that. A lot of this is very similar. Their goals are very similar to what we're doing right here. So they have a framework that's grounded in 4 main components. So the first is they seek to develop a shared understanding. And once that's there, they work to cultivate a state of readiness, which we all know community readiness is key if we're really going to build momentum and make change. And then they focus on collaborating with a cross-sector of partners, which again, we all kind of represent that cross-sector of partners here, everybody on the call today. And then with that, they can really kind of focus on growing the community. So they at BCR have found that the pair of ACEs tree is kind of that first step to developing shared understanding. So I feel like I need a drum roll, but here it is. So this is the pair of ACEs tree. So I'm going to read a quote from BCR because again, this is really something that they developed. This isn't ours, but just something that we, again, really kind of resonated with us. So BCR writes, the original BCR pair of ACEs tree image grew out of the need to illustrate, in simple terms, the relationship between adversity within a family and adversity within a community, which BCR has coined the pair of ACEs, adverse childhood experiences in the context of adverse community environments. Since its creation in 2016, the visual depiction of the tree has been widely adopted as a tool to help communities educate, advocate, and build coalitions to not only bounce back in the face of adversity, but to bounce forward. So as you guys can see in the diagram, so above ground, you'll see the tree. And the leaves of the tree, they represent adverse childhood experiences, the ACE acronym that most of us are familiar with. So these are the factors that we talked about earlier that the ACEs survey measures that are related to the outcomes of health, opportunity, wealth, and you can really kind of see these materialize in a child in clinical settings, in educational settings, and also in social service settings. But then, so again, going below ground, when we take a look at adverse community environments, this is the soil that the tree is planted in, or adverse community environment, sorry. So this is the ACE acronym that's at least newer for me to my frame of understanding. But essentially you'll see that the tree is planted in poor soil. So it's inflicted with poverty, discrimination, community disruption, lack of opportunity, economic mobility and social capital, poor housing in terms of quality and affordability, and then also violence. So this soil, it lacks nutrients, water, and the fertilizer it needs to help the vegetation that's planted within it to grow, to be strong, hardy, and unwavering. So BCR also writes, often steeped in systemic inequities, roots planted in such soil result in stunted growth and the withering leaves on the tree, which is, I don't have a green thumb. I wish I did. I have like one plant that I'm kind of keeping alive right now, but I'm sure that's all of you know that. You can do the best job, plant the best seeds. You can really do that, but if your soil is poor, the tree won't grow or your plant won't grow. So adverse childhood experiences, we know they're going to impact a child's well-being. There's no doubt about that. But we kind of see this tree and know that it's our responsibility as community-based organizations to not only look at a child's personal experiences, but then also the soil that they've been planted in. So what we can do is work to infuse as many essential nutrients as we can, which will really kind of help kids blossom. So a lot of times this lays in advocacy, policy change, and doing things that will really help us address the systemic factors which negatively impact entire populations. So really kind of taking a look at population level health, moving upstream, which is one of the terms we use in prevention that Amy is going to talk a little bit about later, but really how can we make change that will impact the entire environment that all of our kids are growing up in. So this might involve enhancing food security, increasing access to medical care, putting healthcare of all different types into our schools, parenting support programs, mentoring programs, and even creating multilingual and culturally appropriate information. This is something that I think we constantly need to keep tabs on our community and their needs and make sure that that really can be a barrier to access if we're not hitting the right points. So I also want to point out that each tree for your community, so your community could be the organization you work in, it could be the population that you serve, it could be your larger county, it could be the state. You really can define community in any way, but every tree is meant to look different. And if you're doing this right, your tree will look different because you're really supposed to use this to tailor the different factors that are going on. And this will allow you to analyze your environment, and then that allows you to better tailor your response. So we also, the tree can show historical trauma. So for example, of course, in New Jersey, Hurricane Sandy, the Great Recession, and of course, the COVID-19 pandemic, it's all going to impact the tree and what that looks like. So BCR has a really great template on their website, which we're going to link you all to at the end of this. So you can basically download that template, and there's spots for your own adverse childhood experiences and adverse community environments where you can put information in, you can data in, and it's a really great way to kind of create a tool that you can show to your organization, your community members, or even to policy leaders if you're having a conversation, to show them how everything is kind of interacting together. So this is just a story from one of the communities that BCR works in, just to kind of drive things home to you all. And this is really from a youth's perspective. One of my favorite parts of my job is really working with kids. And one quote that always stands out that one of our youth members said was, "Nothing about us without us." And really, if we're working to impact youth in their lives, we really need to make sure that we're hearing their voices. So I wanted to include this because this is a story from a youth that lives within a BCR community. So for some context, this is a story from 2017 and I'm sorry if I pronounce things wrong, but Ballou High School in Congress Heights, Washington, D.C. So there was some backlash in the media, basically, that a significant portion of their class of 2017 graduated, even though a lot of them had very high rates of absenteeism. So the school faced backlash, and the school's valedictorian asked the community and basically the world to kind of take a closer look before they accused them of not deserving to graduate. So she pointed to a strict rule concerning how if you miss 1 or 2 classes in the district, you are considered absent for the whole day, but then more importantly, how adverse community environments affect their ability to get to school. So the valedictorian, Litzy Valdivia Cazol, she collaborated with a writer from the Washington Post and asked the world to consider the structural racism and systematic oppression of Ballou students that they experience as part of their everyday lives, and how their parents rely on them for childcare, or how they rely on them to work to help feed the family, or how housing instability and chronic neighborhood violence impacts their realities. So she posed how these variety of factors are at play and questioned how the community could improve the school. So she stated, but to turn around a school, we need more from the rest of the community. Students must trust that caring adults will do what is necessary to address poverty, joblessness, housing instability, food insecurity, and community violence. Ballou students want to be able to show up to school every day and focus on the future, but they need you to create a world where that can happen. Perhaps we should focus less on student absences at Ballou and ask why the rest of DC's adults haven't shown up. So I think that's a pretty powerful statement coming from a 17, 18-year-old. And she really pointed out to us that it's our job as the adults in this community to improve their soil. So that really, at the end of the day, that is our role. So now that we have a solid understanding of adverse childhood experiences and adverse community environments, we kind of wanted to just bring things a little bit more local and just briefly kind of run through what's kind of going on in what we call the garden state soil, kind of see how well we're doing, and how this might play into both what's going on above ground and then also below ground as well when we're talking about a child's outcomes. So we know that 9.5% of residents in the state of New Jersey are living in poverty. But one of the numbers that we like to look at the Institute and kind of just when we're doing our data collection is the number of ALICE households. So ALICE stands for Asset Limited Income Constrained Employed. And this is a report that comes out of the United Way. They do these reports, and this is specifically from the United Way of Northern New Jersey. They put together the report for the whole state. And they found that there are 1.2 million ALICE households. So this really kind of goes to show you that there are, in addition to kind of where the poverty line lies, there are many, many, many households that are living paycheck to paycheck, that don't have a nest egg of savings. And really at a time like this, like during the pandemic, that it could have really dramatic effects on that. So this is just kind of another measure that we like to take a look at. That's also another report that I highly encourage you all to take a look at if you've never seen it before. So there are also 78,000 children who remain uninsured in New Jersey. And about 40% of those kids are not eligible for current programs, which absolutely ties in with healthcare access in a lot of different ways. We also have 32% of children in New Jersey living in low-income families. And 56% of these children who are living in low-income families are living with a single parent, compared to 17% of children who are in above low-income families living with a single parent. So this, of course, can impact the amount of time that a parent has with a child, helping a child with schoolwork, helping them, just in lots of ways, based on the need of working, and all the different competing priorities of a parent. There's a lot going on there, so just something interesting to note. And then also 14% of children in low-income families moved in the last year. So when we look at community disruption, this is a major factor, and also housing instability, which is one of those adverse community environments that we saw below the soil, that this can kind of impact that as well. If kids are constantly moving, that disrupts their connection to school, to friends, to volunteer opportunities, things that they're involved in, and just kind of their neighborhood on the whole. So also taking a look at the National Survey of Children in New Jersey, they found for 2017 to 2018 that 38.5% of children do not live in a supportive environment, but this does mean that 61.5% of children do. That is awesome. We like to kind of flip the statistics too on the positives. 70% of children live in a neighborhood that is definitely agreed upon as safe, which is also a really great strength in a lot of our communities. 59% of families read to their children aged 0 to 5 years old 4 or more days of the week. So this is really big, especially, as I'm sure many of you know, in those building years for vocabulary, and just a lot that really sets the foundation. About 31% of children 12 to 17 are working for pay. It's hard to dive deeper into this statistic based on the survey, but it leads me to question, are they not able to go to school? Are they skipping school to work? Are they going right from school to work in order to help their families get by? So that's just something else to point out. And then 56% of children aged 6 to 17 do not participate in volunteer or community service activities. So when we talk about a child feeling bonded and connected with their community, we have a fair number, so about, do the math right on that, 44% of children who are volunteering, which is great, but if we can really kind of focus on getting that higher, what that can do, not only for a child to feel connected, but then also potentially to find a career path that they are interested in, to do an apprenticeship, something like that, that can be really powerful as well. As community members, that might be something we can help with. And we wanted to bold that last statistic at the end, because it isn't a happy one. So 88.6% of kids have at least one other adult outside of their household that they know that they can rely on. So again, we do have some major strengths here in the state. So as we talk about the soil, and again, the things that we can impact, it would be remiss and kind of crazy to not talk about the COVID-19 pandemic and the profound impacts that it will have on our community. So we know that we really cannot even fathom the outcomes that it's going to have yet. We've seen some of them already, but we're really kind of in the thick of it right now, and it's really hard to know the long-term impacts. But we can draw on the impacts of previous historical traumas like natural disasters, economic downturns, and other public health crises to assess what we need to look out for and what we might see coming down the pipeline. So we're just going to run through a few of our concerns. This isn't a conclusive or complete list. Again, things are changing on a day-to-day basis, but just a couple of things that we're pointing out. So first, of course, we are concerned about domestic violence and child abuse and how that plays into ACEs. So for many people, we know home is a safe haven, but for those who are victims or survivors of domestic violence and child abuse, home may not be the safest option. So this is especially true during times of immense stress like the pandemic. So the CDC says that 1 in 3 women and 1 in 4 men in the US have experienced violence from an intimate partner in their lifetime. So there's a psychologist who did a study on Hurricane Harvey, which really made the bulk of its landfall in Texas. And she assessed how families previously affected by domestic violence were impacted during this natural disaster. And she found that the stress associated with the disaster led to higher rates of both domestic violence and child abuse. So she wrote in an article published by the American Psychological Association, "We found social factors that put people more at risk for violence and reduce access to resources, increased stress due to job loss or strained finances, and disconnection from social support systems. With this pandemic, we're seeing similar things happen, which unfortunately leads to circumstances that can foster violence." So again, I know a lot of you know that, but just something else that we're pointing out and other psychologists are encouraging people to pay specific attention to minority communities that are at higher risk, and also to children, because this is something that's unprecedented for them as well. They're experiencing their own stress. And we also know that even parents who typically have great bonds with their kids and kids who have great bonds with their parents are facing stress like they've never felt before, changes in family dynamics. And I just think it's interesting. In one town in New Jersey, the police chief noted that since the pandemic kind of started and really we went down on lockdown, there's been a 260% increase in domestic violence calls. And it's a relatively small town in the state of New Jersey that reported that. So again, that's something that we're monitoring. So second, of course, substance use. So I'm sure if any of you have been on Facebook, you've seen many posts, memes, jokes about drinking during physical distancing. I do laugh at the quarantine jokes, I will admit, but in all seriousness, we do know that the risk of substance use is going to increase during the coronavirus pandemic for both adults and youth. So according to the market research firm Nielsen, so they do a lot of studies on the ways of how consumers are acting. Sales on alcoholic beverages spiked by 55% over the course of 1 week in mid-March. So this is a really, really sharp increase. And we know that economic turmoil, job loss, increased stress and anxiety, isolation, and fear of the unknown and fear of getting sick are all factors that may increase substance use. We also know, of course, mental health is a component in this isolation. We're going to link you guys to a briefing that was done by the Kaiser Family Foundation about mental health and stressors during the COVID-19 pandemic. That's just like a really great article for you all to check out. But one of the major findings of that was that nearly 1/2 of US adults have said that their mental health has been negatively impacted due to worry and stress over COVID-19, with isolation, loneliness, and job loss all playing into this. So we've had over 500,000 individuals in the state of New Jersey apply for uninsurance over the course of the past month. So this is definitely something to keep an eye out for. We also know medical care, so people aren't going to seek medical care if they need it, is really being impacted because they're scared of getting sicker. Housing is impacted right now. So we know that as well based on job loss. And again, this is a historical trauma that we haven't wrapped our minds around yet, but we do want to let you all know that we are thinking about it, and we're doing our best to monitor things and put protections into place now that will help youth and families on the other side of things. Because there will be another side, even though it doesn't always feel like it.
So you've got to think a little bit about what is in your soil, what's in your home, what's in your community, your organization. What nutrients are you adding to that environment? What weeds do you need to pull? Thinking about the current pandemic, how will it affect our soil? Because we very much realize there is going to be a lasting impact for many of us. And Abby said, there's going to be another side. What's going to be waiting for us at the other side? So what can we do now to get ahead of that impact? What do you guys think? If you have any ideas about what are some of the things we can do to try to, I don't know, ease the problems with this pandemic, share them in the chat box and we'll talk about them. Ooh, I see we had some questions. I am going to find out for sure if we can have the PowerPoints available. I know we are recording these with the intent to send them out at some point, but we are still in the process of figuring out how to make that work for everybody.
We definitely, I think that like a PDF we can get out to you guys pretty quickly, and then also the links and the resources, sort of the videos and all that kind of stuff. We'll definitely get that to you guys out by the end of the day today. That's a little bit quicker to kind of, we have that list ready to go. All right, so this is just also something, again, like reflective that you guys can kind of take time to think on. Also just to kind of think of what's on, like what's in your soil of your own family, what's in the soil of the organization that you work for. You can really kind of get to the nitty gritty of this in a lot of different ways. So it's just kind of something interesting to think about. And again, everybody's soil is going to look a little bit different. Yeah. All right, so As we get to the end of the webinar, we did want to kind of just briefly talk about some positives. So how can we be the fertilizer? How can we take action? How do we weed, fertilize, and make the soil healthier? Maybe get some green thumbs and kind of improve upon our gardening skills if we're really going to kind of take the analogy there. So we're going to talk about a few ideas, a framework, and some tools that you guys can use to address ACEs, that you kind of walk away with some actionable steps from today, in addition to kind of having the tree and being able to make your own tree. Okay, so we saw through the Pair of ACEs tree that in order to really kind of use this to the best of our ability, we need to develop that shared understanding. We have to get everybody on the same page. And once we are on the same page, we can kind of mobilize, generate more community readiness, help people understand why this is important. The data really helps doing that, both quantitative and qualitative data, telling those stories. And then collaborate with cross-sector partners. Again, all of you represent so many different backgrounds. And then this will really allow us to make change. So we can use the tree to develop a targeted approach that specifically addresses our community's needs when it comes to adverse childhood experiences, but then again, those larger things that are affecting the entire population, adverse community environments. So with all of this, we can build resilience. So we're going to show you guys another video. I can get this. Again, I'm sorry if it's loud.
Resilience is not some magical quality. It's something that really can be built, even in difficult circumstances.
The key active core ingredient to building resilience are the relationships kids have to others who care about them.
Of course, families play a very important role, but nobody raises children in isolation. We have a huge amount of research to show the powerful impacts of teachers, coaches, other adults in the community with whom children have a chance to develop relationships, who play that critical supportive role of building resilience. As a result of responsive interaction, children build simple skills of coping and adapting. How to stop crying, how to regulate your behavior, being able to defer gratification.
You have an adaptive toolkit that allows you at moments of stress or challenge to bring out a number of potential skills that allow you to get through it.
As children get older, the sophistication of those skills increases. Being able to monitor situations, solve problems. The way we as a society can nurture the development of resilience is to help communities to pay more attention to building the capabilities of the adults who care for children and provide the supports they need to tip the scales toward more positive life outcomes.
And then when communities say, we want to be an active part of crafting the solution to really understand what's necessary to produce the resilience, that's when the ball gets rolling.
Resilience building, capacity building, is really in everyone's interest, and everyone reaps the benefits when we do that well.
Okay, so as we saw in that video, the main component of resilience is the presence of supportive relationships with parents, coaches, teachers, caregivers, other adults in the community, really role models and folks that kids look up to. So any interaction with these trusted adults and mentors help kids build the skills that they need to manage stress and cope with adversity. So really kind of going back to that very first video that we saw, it really is helping them with that air traffic control. So if we put the right people in place, we can help them develop that ability. So if we help communities build the capabilities of adults who are in turn helping kids build these skills, we can build protective factors and resilience at multiple levels. So not only within youth, but then also within adults. So from this, we can enrich our soil, and this will in part help us mitigate the impacts of adverse childhood experiences and adverse community environments.
Okay, so we also wanted to talk about a prevention framework that we use in our prevention work called the CATCA 7 Strategies for Community Change. Now, CATCA stands for the Community Anti-Drug Coalitions of America. It's an international organization that developed a group of 7 methods to bring about community level change, okay? And of course, like I said, it's known as the 7 strategies. So each of these strategies is a best practice that represents a key element to building and maintaining a healthy community. So how can we apply these 7 strategies as a framework for something in our community that could prevent or even potentially reduce exposure to these ACEs? So let's think about the development of a youth mentorship program. Mentorship programs often afford children the opportunity to be paired with somebody, maybe an older child or even an adult who could serve as a positive role model for the child. The mentor could spend quality time with the child, offer support to the child, help with their schoolwork, even become a source of fun for the child and allow them to mentally escape from potential negative circumstances that are back at home, that are difficult for them to deal with. So let's see how using the CATCA 7 Strategies framework can help create this mentor program. So the first step would be to provide information. So you could provide information to someone like the local school board, the school staff, parents, even other youth-based community organizations about a possible mentorship program, illustrating the need and importance of implementing mentorship within the youth of your community. And you could do this in many different ways, including things like presentations, media campaigns, all over social media, town halls, things like that, okay? Step 2 would be to enhance skills. You can then develop and provide trainings for those who wish to become mentors, utilizing specific program guidelines, curriculum, things like that to increase their skills and knowledge regarding the best mentorship practices to be used in this program. Step 3 would be to provide support. So once your mentorship program is in motion, you can continue to provide support to your mentors and different program partners by offering different things like ongoing leadership trainings, even other activities and get-togethers with both the kids and their mentors. And so these first 3 are known as individual level changes, as you can kind of see on the right there. They tend to focus on individuals, their families, or otherwise smaller groups of people. And many organizations that work with interventions and ACEs focus on this level of change. And this could be super, super important for those individuals and families that are impacted by these challenges. So let's go on to step 4. Step 4 is to enhance access or reduce barriers. So obviously, oftentimes, access to programs like these can be difficult for children to attend. So to increase the access and reduce barriers for their attendance, you can do a number of different things. You can try to assist with transportation issues by working with your school district to offer late buses, if the district doesn't already offer that. Some schools do and some don't. You can work with schools themselves or other community organizations. Maybe they can donate space for this mentorship program, donating hours of their day where the mentors and the kids can be there together working on different things. Or you could even provide snacks or an early dinner to some of those children who may not have as much access to nutritious and healthy food options back at home. Step 5 would be to change the consequences. So you have this mentorship program, you can then even maybe use it for something like incentives or disincentives. For example, you can make the program mandatory for those who get in trouble with the law in order for station house adjustment options to be utilized. Or you can even provide a reward of some type in school for students who choose to participate in the program. Maybe something like a dress down day if they have a dress code, or a get out of gym for a day pass. I know I would have loved that in school because I was not a fan of gym class. Maybe even something like a homework pass for a simpler assignment, something like that, just to increase interest in the program and get more kids involved. Step 6 would be to change the physical design. Once the program gains momentum and popularity, perhaps you could even petition for a mentorship program designated room in the school or at the local YMCA, or maybe even down at the public library. Children and mentors could get together and paint permanent murals on the walls of the room. I've been seeing that a lot in a lot of the schools around the county. These permanent painted murals are gorgeous to look at, and you could tell the kids really take pride in putting them together. And these murals can showcase the importance and the meaningfulness of the program for them, and it could be a great project for both mentors and the kids together. If you can't get a designated room for something like this, maybe even painting a walkway or a path in a park could be a nice, worthwhile alternative. Just something to give them the opportunity to showcase this and for others to see as well. And then we have step 7, which is to modify or change policies. So you can even promote changes within the school policies themselves that could potentially lead to a permanent mentorship program, or making it a requirement for children who struggle with negative environments at home, those potential future ACE children, or, you know, maybe even every student in a particular grade level. So, you know, these latter 4 here, as you can see, they're more toward the environmental level of change. They focus on the larger community as a whole rather than just on the individual. This level of change can result in long-term changes that can last and impact generations to come. You know, policy changes can help with systematic issues that are in our soil. This is kind of that whole moving upstream that Abby mentioned earlier in the presentation. You know, people and kids and families who are struggling with these issues, they absolutely need interventions and help to get through these and to work through it. But at the same time, how do we figure out what is the root cause of all these issues? How can we make changes to that so that these kids and families never even have to get to that point where the interventions are needed to the level that they are right now? So when you have all 7 of these steps together, all working together, you're going to yield some of the best attempts at positive changes within the community and within individuals and within that soil. So it's a fantastic framework. You can apply it to just about any initiative that you can think of, especially those ones that could help address ACEs in your own community. And it's a great way to get the community involved together and moving forward on an issue with the community itself.
All right, so we just have one more thing to talk with you all, because I know we're kind of closing in on the hour mark. So we just wanted to mention some tools from the CDC, and they really are like holy grail of putting out a ton of stuff about ACEs. So first and foremost, if you want to know more about ACEs, the CDC has put out some really comprehensive and interesting training modules on ACEs through YouTube. There are a ton of different videos that you can watch. You can kind of filter through based on your knowledge level and see where you kind of holes in your knowledge that you feel you might have and gaps you want to fill. So we have those linked as well on the next slide. And again, we will send that link out to you all. But the second thing is that they've put out what they call technical packages. So they're kind of like toolkits, and they are tools that we can use as community organizations, schools, and youth serving organizations, healthcare professionals, whatever our backgrounds might be, to both prevent and then also mitigate or intervene in ACEs. And again, you'll kind of see, even though they don't talk about adverse community environments, that a lot of these things kind of tie in both above ground and below ground. So these toolkits have 6 main goals. So the first one is to strengthen economic supports for families. The second is to promote social norms that protect against violence and adversity. So again, you can kind of see how these fit in with childhood experiences and community environments. Ensuring a strong start for children and paving the way for them to reach their full potential. Teaching skills to help parents and youth handle stress, manage emotions, and tackle everyday challenges. I know a lot of schools have moved towards including social and emotional learning in their work, nurtured heart, things like that. Connecting youth to caring adults and activities. So like Amy mentioned, mentorship programs, volunteering, getting kids connected to their communities. And then also, of course, when necessary, intervening to lessen immediate and long-term harms. I'm sure that a lot of you on the call work with youth on a fairly regular basis. You might be mandatory reporters for specific things going on. So of course, we do need to follow those protocols as well and intervene when we see things going on. But just to kind of give you guys some ideas, some of the different things that we could do, it might be paid maternity leave and paternity leave, or the FMLA package was just expanded within the state of New Jersey, which allows parents to be home with newborns or adopted children for longer periods of time. Parent support programs for teens, teen pregnancy and prevention, home visitation for pregnant women and for women with newborns, enhanced primary care, high quality child care, even universal pre-K. I know some school districts are looking at that. Intimate partner violence prevention, family-friendly work environments, which it's kind of interesting that kind of like had to happen as the result of the COVID-19 pandemic for those of us that are working from home and do have children. And props to all you guys, because I know I cannot imagine how hard that is to balance, and it really is. You guys are doing amazing things. Job training, access to work attire, resume building, simple little things like that, but that can make all the difference. Mentoring programs, again, trauma-informed care, things like Big Brothers, Big Sisters, safe dating for teens, and even public education campaigns. So these are all, again, they're different programs, policies that might be evidence-based practices, but they're all supports that we can use, and by infusing these supports for the entire community, we can shift the focus and the blame from individuals, and we can kind of focus on promoting overall environments that are safe, stable, and nurturing, and really will help kids grow. So we're going to send out this video again in the interest of time, just so you guys can kind of watch it on your own, but it kind of wraps up everything well. It's a video from the CDC. And as we mentioned, this is the list of tools and resources. So the technical packages from the CDC, the training modules, that information from BCR, and so you can build your own tree, that brief from the Kaiser Family Foundation, data, building resilience, and then CADCA 7 strategies for community change. And we will work definitely as quickly as we can on getting the slides out to you guys, as well as a recording of the webinar so that you can have it for your reference.
Okay, so now that you've heard so much about ACEs and prevention, do we have any questions? Anything that we could possibly help answer, or whatever you got?
Again, you can also email Amy and I. I'll put, these are our emails. So if you have any questions that you think of later on, we're more than happy to answer them.
Yes, definitely. So like I said, we're going to send out, you're going to get a PDF copy of all of the slides, and then we're going to work on sending a webinar link as well. The only other thing that we definitely want to mention before you guys leave is we have an evaluation for you. You can see the link right there, but I'm going to go ahead and throw it into the chat box. That way you guys can copy and paste that and make it a little bit easier for you.
It's super brief, but it will allow us to kind of have feedback again. And we do have more series, or there's more kind of like episodes of the webinar series coming up. It's every Friday at 11 a.m. So we can also kind of send that out to you guys. So if you want to sign up for more, and if there's any other topics that you're interested in, we're happy to do research and again, and kind of report back out to you all.
All right, thank you so much.
A couple minutes, that way in case anybody has any questions.
How do we grab the survey? Basically, I think you're just going to have to copy and paste. I don't know if the chat box will allow that. It's not allowing me to send it as a hyperlink for some reason. I don't know if you have any better ideas, Abby.
Nope, I just sent it to somebody privately by accident, but I just sent it. Should, you might be able to click on that. And we can also, we'll send out an email with the list of the different resources, and we'll put the evaluation link in there as well.
Yes.
Awesome, seems like it's working.
Yeah. Awesome.
There's always a couple technology bumps.
Always. All right, guys. Well, we'll hang out for a couple more minutes. If you have any questions, let us know. If not, we hope you have a wonderful weekend and please stay safe.
Yes, stay safe and healthy.